with the Michuki rules, which the police officers are enforcing this morning, and there's a crackdown. If you're not aware, just be aware right now that yes, maybe you might need to spend a little bit more, because also they're hiking fares this morning as well. But I want to draw our attention this morning before we take a short break, and Anyang Nyongo, this I think really falls smack dab in the middle of your domain as well. This is what was on the front page, not really on page 4 of the Sunday Standard, right? A special report there. Why counties now spend 15 billion shillings more for unused machines? And it says that the Health Ministry is once again on the spot of a substantial variation in the controversial medical equipment leasing scheme that will cost the taxpayer an extra 15 billion shillings. Initially, the ministry had entered into a deal with 5 global companies for the supply of medical equipment for 2 hospitals in each of the 47 counties at 38 billion shillings. Now, in 2015, in the 2015 deal that attracted the wrath of governors, the ministry would deduct 90 million shillings annually from each of the 47 counties after it signed a 7-year leasing agreement with the US, China, the Netherlands, India, and Italian firms on behalf of the devolved units. But somewhere along the way, the ministry varied the deal that has seen each county now paying 200 million shillings annually from July this year. Now, if you don't have maybe a brief history of this, we can also tell you this, how controversy dogged the health ministry equipment deal that is on the next page as well, of how controversy dogged the health equipment. The multi-billion shillings medical equipment leasing deal has been shrouded in controversy since it was launched with opposition from stakeholders. Unveiled in February 2015 by President Uhuru Kenyatta, the intention was to have Kenyans access affordable, specialized healthcare in the counties. Such services were previously a pre-serve of Kenyatta National Hospital and Moi Teaching and Referral Hospital in Eldoret. Immediately after the launch, several governors led by the former Council of Governors, Chairman Isaac Ruto, refused to sign the MOU for the leasing of the theater facilities, dialysis kits, intensive care unit, equipment and x-ray machines, which cost 38 billion shillings. So maybe we can ask you, Governor, from 90 million shillings to 200 million shillings, are you paying this annually?
Yes, and
you're paying this annually.
We really, in the Council of Governors, have questioned this thing. But see, this thing was handed over to the counties a fait accompli by the national government. The Senator will remember in the Senate, we even asked the Health Cabinet Secretary to come to the Senate and explain to us how the thing came about. After his explanation, we were not satisfied, but it was already a fait accompli.
Yes.
The things were already there. And I think the national government was really unfair to the county government, because this push thing that you establish the needs of the counties during the era of devolution without the demand from the counties was wrong ab initio. It was wrong. It was a really wrong premise on which to buy these things. But what it was is that after the...
But why did you raise any,
a
special language with this 200...
The Council of Governors raised it, and the Senate raised it. We had the CS come to the Senate and talk to us, and even after he talked, we were not satisfied. But as I tell you, it was a fait accompli that had already been done. And the equipment was already here. It was being pushed to the counties. I mean, the situation was, which was both embarrassing and frustrating. And now at the moment, how the thing has jumped from 90 million to 200 million is as baffling as the peace of God which passeth all understanding. You see, and I get very frustrated because there are other priorities we have. What kind of equipment do we need? What kind of hospitals we have? I mean, this idea that you deal with diseases by buying equipment, no. I mean, equipment should follow an analysis, of the resources that you have and the stage at which you are in terms of building the capacity in the counties to deal with these things. I'm not saying that having a PT scan is wrong, no. But it should come with a price you can afford, and at a time when you have the personnel and the plant to accept the thing. In many cases, these equipment went to the counties, and they were in crates for months before they were used, because there was not even a place to fix it.
Even some of them are not really unpacked until today.
Now, yes, you see. So
because you don't even have specialists
and so on. So that's one thing. This push policy was wrong at the ab initio. And I really think it is a very unfair bill on the counties. But as I say, the government just decided before the 2013 that they were going to buy these things, and the genesis of these things is really baffling.
All right, let's hear from Senator Kongo Mogeni before we take a short break, then we continue with the discussion, or Senator Pogiso for that matter. Let's hear from Senator Pogiso. We come to Kongo.
I think that what the governor is saying is, of course, I wasn't in the Senate then, but we could follow then what was happening. And you find a very small county like West Pokot County, which is not really a big county, with all those equipment, some of them still in crates up to now, not being able to be installed. In fact, some of those places, even the rooms where they should be installed are still being constructed. In some places, theaters are still being constructed up to now. And so if those equipment were valid and up to date.
So this is since 2015?
Yeah.
So they're still under construction?
Exactly. And I'm saying basically if, for example, the machines were state-of-the-art then, they cannot be state-of-the-art machines now. And so you'll need to either upgrade them or now begin to look for the next models of them. And I think that's why I think the query should have gone to themselves to say, well, what are the machines doing in crates? Some of those machines which have not been able to be deployed. But having said that, I think it was also that time the beginnings of devolution, and I think that was easy at that time. I don't think they can do the same thing now with the current governors, because then I think even now they might be having if they were to be started now, there'll be a lot more questions. I hope so, and that people who are there now. But it was then easier because I think also you know about the tyranny of numbers was a problem even during that time. And so if in the houses, if tyranny of numbers had anything to do with it, nothing could be challenged. Yeah. Because it's a political decision. And I think that sometimes it's a big problem when everybody just says aye and everything goes through. And then the cost up to now cannot be, you can't account for it. You cannot justify why counties would have those payments made every month or every year, and they are not using the equipment. That's not very.
But the question is then, you as senators, how has this really flown off your radar? That you've not been able to question why this particular sum was raised from 90 million shillings to 200 million shillings for a long protracted time, right? These are answers we seek from you. We want to take a short break, but when we circle back, of course, we hear from Kongo Mogeni why the senators not really, of course, up to scratch with this particular development. Why was that particular sum of money raised from 90 million shillings to 200 million shillings that the counties are paying, of course, to the national government? That is a question we need to probe. So don't go away. This continues on the other side of the break. Right, welcome back. You're watching This is the Point here on AM Live, and we continue with our conversation. We are looking at the 15 billion shillings Afi House scandal, where the health ministry is under, of course, the health ministry under CS Cecily Kariuki is once again on the spot of a substantial variation in the controversial medical equipment leasing scheme that will cost the taxpayer an extra 15 billion shillings. And we are getting, of course, first-hand information from the governor himself of Kisumu, who maybe will speak for the counties that this is truly happening. But what we're failing to understand is why has the Senate failed to raise this particular question of the amount that is being raised from 90 million shillings to 200 million shillings by the national government. Is there any rhyme or reason for this? And we promised we'll circle back with you, Senator Kongo Mogeni. Why have you been mealy-mouthed about this particular?
No. I think Dibal first had to, state without any fear of contradiction that this is one of the issues that the Senate has flagged, and this is one of, I think, those issues where we have more questions than answers as the Senate.
What issues? Is it the unused medical equipment or the monies as well? So we are speaking on two different issues here.
Let me even speak for, let me go down to my county. We went with the Parliamentary Committee on Budget to the county of Nyamira, and we visited the county hospital, referral hospital. Mm-hmm. And we tried to ask, the county government medical staff to tell us something about these equipments. because the medics there were telling us normally the lifespan of medical equipments, and maybe Professor here will tell us, is like 4 years or so. But they told us we cannot give you any answer on these equipments. They were just brought by national government and dumped here. How they were procured, what informed the procurement, nobody knows. But the bigger picture is this. When the Senate was enacting the County Allocation Revenue Act, and you can go to the answer, what I'm telling you is something that is factual and is documented. We flagged out this allocation of 9.4 billion, and we said we are approving CARA minus these 9.4 billion shillings. So if somebody is paying out this money or deducting this money from county governments and paying some foreign entity, it is without the blessings and approval of the Senate. 2, this issue is pending before the Health Committee of the Senate. And I'm aware that on 2 occasions, summons have gone out to the Minister for Health to appear before the committee and shed some light. Because how do you just wake up one day and tell county governments that you have increased the expenses on these equipment by over 200%? And then there are so many questions. I don't know. Governor Anyang' Nyong'o should tell us, if you are leasing this equipment and you are paying this amount for every year, what happens at the end of the lease period? I mean, is there value for money? Could we not have gotten a better deal by purchasing these equipment and not leasing them? And then you try to ask questions. Why was the county government involved in this? Because I've read Article 6 here. It says the governments of the national and county levels are distinct. And then they will conduct their mutual relationship on the basis of consultation and cooperation. So if you are committing county government to some contract that was signed on their behalf, can that take place without their involvement? Especially when you read Article 2 of the Constitution, which says this Constitution is supreme and binds all persons and all state organs. So really, I think this is something that we should give a name of a scandal. I don't understand how the government could have engaged in this kind of, initially it was involving 38 billion. Now I think it's moved to I don't know how many billions. And you will never see the face of county governments. If you ask a professor here who signed this contract on behalf of Kisumu County, he will not tell us. I was in Nyamira County government doesn't know who signed the contract on its behalf. So what we need to really state here today is that this is a big scandal in the making, and somebody in the Ministry of Health is ripping off county government, and it's a fairly oppressive contract. Anyang' Nyong'o never receives this money and then he pays the person who is leasing the equipment to him. This money is deducted at source.
At source, yeah.
The government deducts that money at source before it reaches Governor Anyang' Nyong'o or any other governor for that matter. Now, tell me, if county governments are supposed to have county integrated development plans for 5 years, you are supposed to pass your annual budgets, then isn't that a situation where the role of county governments is being taken over by the national government without consultation with county governments? I don't know. To me, I think this is something that should attract the interest of Nuruddin Haji. If there is an issue where we need to see him on the media with a statement telling us that he has directed investigations to be undertaken, then it's on this equipment. If he doesn't act, then I think I'll also say he's being a disservice to this country.
All right. Okay, let's hear from Kembe Gitura.
I think I was in Senate when this 38 billion shillings was allocated for the purchase of the equipment. And I personally believe that this was done in good faith. That is the leasing. And if I remember correctly, the reason there was leasing was because it was found that you cannot buy medical equipment, outright. You could if you wanted, but everybody will tell you that the lifespan, like they've said, is very short, about 4 years, maybe 5 years. And therefore it needs to keep being, refurbished, changed to be modern. And that's why the leasing was meant to be such that whoever the lessor was, who is leasing it to the government or the county government, would then continue to improve it as time goes on and the leasehold money being paid for that equipment. So I think it was a good idea, because the value must accept that that health, although devolved, and I'm one person, and I'll say this on national TV, that I still believe that health should have, the devolvement of health should at the best have been staggered, not done immediately. Because like education, like security, health affects everybody, every Kenyans, every day, 24/7. And this is an area, in my view, that should have been, maybe more care should have been taken, and the devolvement of it could have been staggered, so the counties were ready to take it on as a devolved function. But then it was the way it was done. I'm not surprised that the government of the day in 2017 thought it should be involved to save lives and to help people, because it had its own thinking, the way it wanted to have things done. And today I want to tell you this, Debal, that the most risky thing in this country of ours is to get sick. Because if you get sick, you know immediately that the bills will start escalating, and within a month, you'll be calling Harambee to help you out with your bills. And the idea of having level 5 hospitals in all the counties was so that we could have a filtration system, so that before you come to Kenyatta National, before you get to the level 5 hospital of your own county, you have gone through the clinic, through the dispensary, through the, all the system, and then ending up in Kenyatta or the other level 5 hospitals as the need arose. But today that's not happening. Today that's not happening because this equipment doesn't appear to be working in a lot of counties. The question I would like to pose myself, particularly to a person who is so well versed in these issues, I don't think anybody understands these issues better than Governor Anyang', who was a minister for health, in the last Kibaki government, a person who was a senator, therefore saw this money the way it was being shared out, a person who is now governor who is consuming, devolution directly for the people of Kisumu. I would like to have what he thinks about it. But I think that we need to continue to improve the health in counties. And I think myself that the national government needs to continue to be involved as much as possible without interfering, because after all, they are serving the same people.
Thank you.
Without appearing to interfere with what the county governments are doing. If there is fraud or there is a scandal in the issue of the leased equipment, then obviously something has to be done. When I read about 15 billion shillings yesterday happening at the Ministry of Health, Afia House, some people call it Mafia House, but Afia House, let these matters be investigated. Let us get to the gist of it, because at the end of it, it is the Kenyan citizen who is suffering because of lack of health. But if the equipment is still in crates in some counties, then that begs a bigger question. What is happening at the counties?
Right.
What are the governors and the senators doing together, and what's the Council of Governors doing to say that this equipment should not have been paid for because it has not been found to be useful to the counties where it was supposed to be used?
Professor, we'll come to you just in a moment. Of course, we answered the question of the universal health care. If at all the infrastructure is not also a component of that, then how do we even call it a universal healthcare? Because we always focus on the finances bit, but we hear here and we read the amenities, infrastructure, accessing these particular facilities is a problem. How also is that adding to maybe the tripping wire of us achieving and realizing universal healthcare? But we want just to also prime our views this morning on the current state of play as far as Michuki is concerned. Just briefly, then we continue with the conversation and we hear from Professor Anyang'. We head over now to Buruburu to just get a reality on the ground, where we have Sharon Baranga, who's standing by to give us a snippet of what is happening on the ground. Good morning, Sharon.
Good morning, Dibal. It is not such a good morning for a number of people who rely on matatus, or what we call public service vehicles, for their day-to-day movement around the city. Right now, currently, I am at Mutindwa stage in Buruburu, at an intersection where it is normally used by people from Umoja and Buruburu. And as you can see, we have a number of people stranded on the stage just waiting for public service vehicles if they are going to be lucky, because we have a few of them on the road. Most of the people have withdrawn their matatus on the road, and as a result of that, we have a number of private vehicles right now on the road that has also contributed to the traffic that you can see right now. As I can move from this side of the road, you can see that we have a number of matatus that have been withdrawn from the road. The city hopers, perhaps because they have not yet complied with the traffic regulations. And yesterday we noticed a number of vehicles in some of the garages trying to, rush and comply with the traffic regulations ahead of today, which they had been given by the government as the deadline to comply with all these traffic rules, just as a way to try and restore sanity on the roads, and as well as just reduce the number of accidents that we've been witnessing. But as of now, we still have people, some opting to use motorcycles. Again, it is a risky affair, it's a dicey affair because they are not allowed within the CBD, but we still have people who are risking to use the motorcycles because it's the only option that they have. That is not unless they are, they book for taxis. Back to you, Dibal.
Right. Many thanks indeed, Sharon Beranga there, giving us a current state of play on what is happening as far as traffic is concerned, and that enforcement of Michuki rules, the crackdown, where police officers, they're coming down now hard on matatus who are not really trying to comply with the Michuki rules as well. Of course, we shall be keeping you apprised of what is happening on the ground as well. That is from Mutindo right now. You can see many of them are stranded this morning. We can't see as many matatus as before. Many of them have pulled out, protesting these particular rules as well. Of course, that is the situation on the ground. If you may remember, hacking back to some years back, yes, many of them, even the citizens, they actually bore the brunt of this, and they said, now we're going to stick with Michuki on this until we see a streamlining of this sector as well. That is the situation on the ground. If you've not, of course, stepped out of the house yet, just be aware of that you might be delayed because of the lack of matatus this morning, and many of them, I'm given to understand as well, they've hiked their prices, so you might want also to carry extra cash just in case. We continue with the conversation, and of course, Professor, we were back on that particular issue of the universal healthcare, because most of the times we say, yes, we'll give you the cards, everyone will have the NHIF card, but accessing the facility, that is a different kettle of fish altogether. The infrastructure, the amenities, and this is well displayed here with these particular stories, that if we have these facilities on the ground, they don't even have the amenities. Pogesho is saying some of them are actually right now constructing, or the construction is still ongoing, where they can actually store these facilities. And if we do have these facilities, we don't have the requisite experience with the personnel to actually man these particular facilities.
Well, I think let me maybe say the following. I think the experience differs from county to county. There are certain counties where when this equipment arrives, the right equipment arrived at the right time, so they installed it and they're using them, and they had the personnel. I would think that if you go to a hospital like Moi Teaching and Referral Hospital, which is perhaps now one of the best referral hospitals in the country, they were quite prepared, I think, to consume this equipment. But there are other facilities where definitely people are not ready for this equipment. That's true. But that does not alter the fact that this kind of equipment, under the right kind of arrangement, would really help the health system in the country. Mm-hmm. So what could have gone wrong at the beginning was the conception of the whole thing, the idea that you must tender or buy something for a felt need that has not been properly planned or investigated for. And secondly, it happened at a time when this health system was changing from a highly central one to a devolved system. Mm-hmm. I happen to believe that devolving services like health and education is what is proper in modern times, because you need those who govern to run such facilities which are very close to people or are responsible. For example, if a door breaks down in a sub-county hospital, and you cannot prepare it until you call Afya House. This produces a lot of delay. But if you can pick up a phone and call the county government, the response is much faster, isn't it? So I think devolution makes a lot of sense in the health sector. But let me say the following, that I'll give you an example. When I was Minister for Medical Services, we worked on a cabinet memo, I was just telling Kempi Victoria here, of increasing the number of referral facilities in the country. And we settled at 22 referral facilities after very careful research, because we thought that the referral facilities we had, which were 10 then, were inadequate. And this cabinet memo was actually passed by the cabinet, but when it went to the committee for the implementation of the constitution, they called me and said, look, your memo is outdated because health is going to be devolved and you can't now establish referral facilities without consulting the incoming government. So we are sorry, this cannot go on. And I remember Catherine Moma was a member of the committee for the implementation of the constitution, coming to my office and really explaining in detail why this was. And I understood and I said, well, I'm sorry, I did really good work, but due to devolution, this cannot work. I think this is the kind of thing which should have happened to the buying of this equipment, that if it was bought at that time, between 2010 and 2013, as devolution was coming in, they should have waited in the national government until the county government came in to deal with it. But finally, look, I agree with Senator Mutula Kilonzo that what the Senate really needs is to establish a select committee which would conduct a hearing on this and gather information from both government, even call these fellows from Netherlands and from China and the US and India and Italy who sold this equipment. What kind of contract do they have? It's a select committee like the one we did with Kenya Airways, which really helped Kenya Airways. You see, Kenya Airways has benefited from our work.
Yes.
I think in order to go deep into this, I would plead with the Senate to respond to Senator Mutula Kilonzo's plea so that we have a select committee to deal with it. But finally, just to say something regarding what my friend Kempi said. Look, in a leasing agreement, there are two things. One, they must lay down principles of the leasing. What are you leasing? On what terms? For how long? At the end, like Metamogene said, when the equipment, when it comes to an end, the lease period, what do you do with the equipment? Most companies say at the end of the period, we'll take back the equipment and we can go and recondition it. And now these are new to somebody else. Because the equipment is not all wrong, but there are certain parts which wear down, which you can't keep on replacing. So you need to go back and retool the equipment. I've been to a refurbishing farm in Michigan and see how this happens. And then you can buy equipment which is refurbished much cheaper than new ones. The other thing that must be there is a lease agreement. And the Council of Governors demanded a lease agreement from the national government. What kind of lease agreement? I have never seen it myself. I've never seen it as a governor. So I think there must be, first of all, the principles of the leasing that was established, the lease agreement, and part of the lease agreement should tell us what is to be done with the equipment when the lease period is over.
But you're repeating this money. And
no, I agree. You
but
see, the point
I
is,
thought maybe it should have been honest also the government to know for how long will I be remitting this particular money.
that's what I'm talking about. It must be in a lease agreement. But the point is, if also the money you are paying for leasing is more than what you'd pay if you bought the equipment yourself,
yes,
then the leasing doesn't make sense.
So this make or lease decision, how was it arrived at in the first place?
This is what I'm saying. This is why Mutula Kilonzo's Juniors Committee, Select Committee is important, because you delve into this. Because look as if there's been a dialogue of the deaf here. No, the Council of Governors says we want this, the national government, no, it's already done.
Okay.
So I think there needs to be a Select Committee to go deep into this thing.
Let us see from Pogiso, then we...
Yeah, just to add to what Professor is saying, the blanket decision was that you equip 2 hospitals in each county. So you simply just supplied machines to those. And so those who were ready took it up and used it. But there are many counties that did not even have personnel, did not have the places to put the equipment, did not have even the power, some of the right power to even power this equipment. But it has already been decided, is that 2 of them would go to a county, Turkana, another to West Pokot, to go to Marakwet. And if they were not ready, the equipment would just sit there. That was the problem. And also, there was no accompaniment as to the equipment of personnel who were qualified. It was, again, a county decision to find people who were qualified. There was no saying that within a certain time you must establish this, and therefore this is the kind of plan for the next 2 years for you to complete the building. Some people have not finished building. What if? So I'm basically saying that the Senate, and I agree now that we should probably support Mutula Kilonzo Jr., Senator from Makueni, to establish a select committee, basically a broad-based committee to bring about the right questions and give Kenyans the answers. Because I think that we should learn from this, what I call scandal, learn from it, because it's already named here as a scandal, 15 billion shilling. Learn from it and not to repeat something like this again. So the counties cannot just be told, you're now receiving next one. Of course, the next one might be other equipment, vehicles, or whatever it is. Say now, you must receive this. And that decision was bad, and I think that we should now be careful for this term going forward.
Right. Senator Okongo Mongeni.
Yeah, I think first, of course, I fully agree with Senator Pogisho. But I have a problem with the suggestion by Senator Kembi Gitura that health should not be a devolved function. I think progressive societies all over, the idea is to make healthcare accessible to citizens as much as possible. And based international standards, a response by a hospital to a citizen should be in a minimum of 6 minutes, Professor Jangi. If you suffer a stroke in Nyamira, the solution should not be to bring you to Nairobi. The solution should be to take you to Nyamira Level 5 Hospital and you receive quality medical care in that facility. In fact, we went to Cuba, and in Cuba now, the community hospitals should be able to attend to that emergency. And that cannot really be done by the national government. What we need to do is really to appreciate that we have 2 levels of government, and we need to empower the county governments, and we should stop this idea of big brother syndrome from the national government. I think health should be devolved functions, and it should be a preserve of county governments. Now, on this issue of equipment, what worries me, Debal, is, last financial year, the money that was deducted from county governments was 6.1 billion. Now, this financial year, it is 9.4 billion. I don't know what it will be in the next financial year. And this cycle, I understand, is supposed to run for, 7 years. And these figures keep increasing year in. No, they don't come down. They just go up. Wow. They keep going up. So I don't know how this, as a lawyer, and Senator Gitura is a lawyer, I don't know how this lease agreement was worded in such a manner that after every year, you have the lease sum goes up by 200%, 6.1 billion up to 9.4 billion. When the lifespan of the equipment is actually going down, the maintenance costs are going up. I mean, this is something that should worry us as a country. And that's why I began by saying that this contract, right from the beginning, it looks very oppressive. It's oppressive to the county government, and it's oppressive to us as the people of Kenya. And I fully agree with Senator Pogisho that there are some things we need to put a stop to. When you take people to court, you want to ensure that some of these offenses are not repeated in the future. And if the government went wrong on this one, we should never give them another opportunity to do the same thing in the same misguided, I'm sorry to use that word, in the same misguided manner again next year. So really, Debal, my concluding remarks is that I think this is a matter that we should flag. We have flagged it as Senate, but I think we should give it a keener interest. Mm-hmm. And I agree with the proposal by my good friend, Senator Mutula Kilonzo, that maybe the way to go is to have a select committee of the Senate to look into the details of this issue and tell the people of Kenya whether there is really value for money on this.
Thank you. Kembi, before we come to you, and of course we need to question the sort of contractual agreements that we enter as government with maybe government to government that is not really, also full disclosure to the public. Like what we enter, the contractual agreement that we enter with Chinese, we just hear, yes, we are in this agreement, but we don't know the components, the items, or the articles of this particular contractual agreement, only to realize later that, yes, this was not really a wise decision. buy or lease. But let's just read some of the reactions that we have also from social media. We have Dr. Kakai Kalubusia, of course, from Edgerton University, saying this medical equipment scandal is also squarely the failure of the county government. They ought to have started by building capacity on specialized human personnel to operate the equipment. And still also on him, he says that a CT scan and MRI machines are extremely important equipment, MRI, but they just uninstalled in most county referral hospitals. The county government have completely refused to further specialized trainings. We can't blame national governments. It's well covered in lease agreement. Also, we have Jacob saying the Afia House scandal from what go was big. Jubilee caught a skunk, let them carry it. The previous county bosses like Azat Ruto, the governor, opposed it, for he knew it was a tall order. Let's just hear from Kembe. Those are reactions from social media as well.
Very important reactions, if you ask me. And I think that's the point that I was trying to make. Governors signed, if I remember correctly, it was only Governor Isaac Ruto of Bomet who withheld his hand for a very long time, but he finally signed and agreed and accepted this equipment. He's the only one I remember. I don't remember anybody else. And I would like to correct a misconception here. I did not say that health should not be devolved. That's not what I said. I said maybe it should not have been done as suddenly as it was done. Maybe it should have been staggered to make the county governments ready for it. You don't win, even animals don't win their young ones immediately they are born.
Yes.
They give them time to know what is grass and how to eat grass. I mean, these are nature things. And the point I was making is that Senator Pogisho has told us that in West Pokot, for instance, there are no buildings yet for some of this equipment. The question is, in the last 5 years, what has the West Pokot government done towards getting their priorities right so they can have these buildings ready so they can put the equipment, whether it is this or future equipment. Think about a dialysis machine, for instance. I've seen it in some level 5 hospitals, even level 4 hospitals. And if you have 5 dialysis machines in Murang'a County, which is only a level 4 hospital, the number of patients whose lives are saved and whose money is saved because they don't have to come to Nairobi for dialysis is tremendous. And this, in my view, is the way to go. It's not a question of a big brother syndrome.
Yes.
It's a question of what needs to be done now and by who. Why does a patient have to come from Murang'a, for instance, for a matter that can be treated in Murang'a if the priorities had been taken correctly and the right equipment was put in the right place? Because in 5 years, by now, if the county governments do not know the priorities, the diseases that afflict us in Murang'a are not necessarily the same diseases that afflict people in Kisumu. And therefore, whoever is the CEC in charge of health should be able to know what are the priorities for my county, what of this equipment am I supposed to install first before I go to the next one. I do not agree with Senator Morgan, who is a senior lawyer, saying that they don't know what the leases talk about. Article 35 of the Constitution gives rights to information. Let him show it, and by the way, not even to an institution like Senate. It says that every citizen has a right to access to information held by the state. Therefore, if I as a private citizen today wanted to know what is in the lease agreement, all I need to do is ask for it at Article 35 of the Constitution. Now the Senate, for Senate to say it doesn't know what is in these lease agreements is taking it too far, because they just need to demand to see, the Health Committee only needs to demand to see the lease agreement, and there are more lawyers than ever before in the Senate. Let them go through it, clause by clause. Let them tell us as a people what is wrong with that agreement. I still insist, Debal, that some counties were not ready for total devolution of health. And that is why, even today, you find that they are not ready. And the question that should be asked to them is this: what have they done? What lessons have they learned in the last 5 years to make them ready for health to be devolved? Because finally it has to be devolved. And finally, it should be easier for somebody to go to Nyamira, like Omogoni has said so correctly, to go there through the clinics before even he gets to the level 5 hospital.
Yes.
Before then he is referred to Kenyatta or to Moi referral hospital in Eldoret, so that they're able then to get what they need to get. My position is where I started, that health is so important, maybe more important than anything else, that we cannot afford to take it for granted. Universal health care, NHIF, for instance, properly done, and I think they are doing a tremendous job currently, and I think every governor should see to it that they are, because the governors should also help the national government. They say they are distinct governments. They're actually not distinct. They're serving the same people. And it's up to a governor to make sure that in the county, everybody has universal health.
Thank you.
Because that 130,000 shillings, which is the minimum that NHIF gives, and people do not seem to know that NHIF also has what they call premium, policies also, where they can cover you up to 7.5 million shillings, maybe 10 million shillings, depending on the cover that you take. I think universal health, in my opinion, is one of the most urgent things to think about, because we cannot afford. I'm not in Parliament now, but my colleagues here are in Parliament and in county government, and every Saturday, every Friday, you are invited to a Harambe, not because somebody has died, but because somebody is going to India for a kidney transplant, or to another place for this cancer or the other thing.
Thank you.
This, in my view, is the priority we must take. And instead of arguing about what equipment should be where, we should be finding what priorities we have, so that the people can benefit from the devolved health services, which I still maintain.
Maybe before we come to you, Governor, we should just get a rejoinder from the senators, because he says that you cannot trot us with that excuse that, yes, you're not privy to this particular lease agreement, Senator Okongo and Senator Pogisio as well. While we know, as he's actually read from the Constitution, you have that particular provision from the Constitution that it is your right to get this information. And of course, even now, we have the enactment of the Access to Information Act, right, that is in force right now. So it will be so unfortunate of you to tell us that you cannot actually get the contractual agreement of these leases, Pogisio.
But I don't think any one of us has said it's impossible to get. I think that's really pushing it too far. None of us has said it is. Even you, in the media, you can get it. And that's not the point. The point, in my view, is let's look at this standardized equipment, one size fits all. All counties get two hospitals equipped the same way. Standardized equipment, but not standardized staff, not standardized funding for health. I mean, look here, Riba. We must be realistic in Kenya that people who come from hitherto developed counties like Murang'a and Kisumu and other places do not understand the uniqueness of places which hitherto have been marginalized. The northern frontier counties, for example. You tell me which specialists would like to go and work there. They don't have trained personnel from their own counties. They have never had, for example, doctors in some of these counties trained within their own counties, doctors and specialized doctors, because that requires master's degree and so on. Mm-hmm. This is not a place where you just say, let's have the equipment there because you will need it, and then the equipment there sits. We still have to refer people out of West Pokot for these advanced treatments in Eldoret, because that's where actually the machines fit. And so I'm just saying, basically, let's understand that there might be a specialist here who may want to work. He will choose to work in Murang'a. He will choose to work in Kisumu, choose to work in Nairobi. He will not want to go to Garissa. He will not want to go to Mandera. He will not go to Turkana, West Pokot. And so all these things, power has just entered some of these counties for the first time. And it's mostly single faces. And by the time they are through with what you call a three-phase, that is another thing altogether. They didn't have water. You take that for granted in the hospitals. And so I'm just saying, basically, what we have not taken into consideration is, if you standardize equipment, you must standardize the funding for that particular sector, so that everybody then has a chance to train doctors, has a chance to specialize, has a chance to bring power quickly, and things like that. But it wasn't done. And so you can see why some places are still behind in equipment installation. So let us not, in fact, on the issue of information, for example, access to information, that is true. I mean, we should not be talking about an ability to get information in this modern age, because we can get that information. And I'm sure when we do a select committee, the first basis of it is to get those lease agreements and go through them and comb through them, so that we can then have the right kind of questions to take to the field. And so I'm asking that we start thinking about health and the devolution of health as a specialized way of equalizing and equalization of all health facilities, including being able to afford trained personnel specialists in places which are hitherto. And that means you have to pay them more. You have to find a place where they can stay with comfort, take their children to school. It's a bit difficult, and I think that's where now the imbalance comes in. And so when you tell me that, okay, if you tell me that West Pokot, the priority is to build a facility to house these things, and you know there are other priorities which you really cannot. For example, health. Funding for health goes mostly to paying personnel, more than even anything else. And so in those counties where their funds are lower than other counties, you have to understand that they will not be able to keep up with the speed.
All right.
Yeah.
All right. Okongo, we'll come to you, Prof.
Of course, the bulk. I want to tell you one thing. Anytime you see that the government wants to hold some information unto itself, that's a red flag. That should raise suspicion. Senator, my good friend Senator Kembi Gitura here, served in the last Senate. This issue was live in that Senate. But if you ask him, and even Professor Nyang Nyong, I doubt whether any of them has a copy of that lease agreement. And, everything is about process, Dibal. If you want to lease equipment for Turkana, county government, I think the most decent thing to do is to share information and have full disclosure of this county government and tell them that we want to enter into a partnership or into a contract with this entity to cost you this much, and these are the equipments we want to give you. Are you ready? Now, what misuse of public funds can we talk of other than in a situation where you pay somebody money, some foreign entity, they are enjoying the money, but the equipment that was meant to be beneficial to us as a country is lying somewhere, simply because this is a contract that was entered by a government without consultation. And I think this new consultation is about consultations, about public participation. You should ensure first, before you bring the equipment, you should first of all do due diligence and ask, will this equipment be of value to this county government? Will I bring that equipment and make it useful to the people who reside in that county government? It's like buying a bus, using a loan from a bank, and you come and park it somewhere, and you continue paying the person who has given you the bus, and you're not using it. Isn't that misuse of public funds? Those are the questions we are asking. I mean, you cannot just look at the interest of the person who is supplying and not the user. It should be of value to us. But if you bring an equipment like what we are hearing of Turkana,
yes,
and you leave it there for 4 years, now the lease period is maybe 7 years, and you're going to pay that provider for the full lease period without making use of that equipment. Is that good use of, is that value for our money, our ad-earned taxpayers' money?
All
Those
right.
are the questions we are raising. And I think let's agree that this thing was not done properly. We cannot have excuses on that. The process was not done properly, and I think that's where we should ask questions from government.
Right.
I'd like to give some information here.
Please.
I think let's make a distinction between the crisis about this equipment and what is going on in the health sector in devolved units. I think those two issues must be distinguished. I know for certain that almost in every county, the sector that most county government give most attention is health. Health takes the attention on most county government because one, health is very important. Two, it is the biggest human resources in every county is in health. And so you are paying for a huge, quite a substantial part of human resources in your county from your budget in health. So you have to pay attention to it. Secondly, the problem facing health, if you leave alone this equipment business, is both in terms of training of human resources at all levels and equipping health facilities from the most basic health facility, the dispensary, to the level 5 hospital. Now, one of the things we have experienced in this universal health care, particularly those counties which were picked up as pilot, is that in order to have universal health care, you must fulfill we must deal with two issues. One, equipment in facilities. Two, human resources. And the equipment you need in a dispensary is not the same equipment you need at a sub-county hospital. The kind of human resources you need at a sub-county hospital are different from those. So the training of these people, the amount of money you are going to spend, the time you need differs from one level to the other. Now, most counties found that when the county governments, when devolved governments started, that they had problems at almost every level, and those problems persist. If you look today, for example, in the Business Daily, there's a column there, poor funding puts Mathari Hospital on sick bed. Medics at Mathari Hospital are overworked, underpaid, and ill-equipped. The situation is worsening with every financial year as funding per patient continues to fall below optimal level. That is Mathari, a referral facility that has been there for years, and it has those problems. What about in counties? So the health sector, I think, that's why we are introducing universal health care. And one of the things we realized in our discussion also with the ministry, that we cannot assume that universal health care is going to succeed unless we deal with two gaps in county government. The gap in human resources, the gap in equipment. And in Kisumu County, for example, we did an analysis and found what the gaps were. Now, if we know those gaps, and then somebody from outside tells you, now, your gap is this equipment, and lands those equipment there, and you say, no, we have much more other basic gaps we need to fit before you go there. I think this is the most important thing, that this equipment was rammed in counties before the gap analysis was done by the national government. I see exactly what kind of gaps you needed to fill in counties to prepare them for devolution. True. I think this is a basic thing. We're not saying that, we're only saying that, look, sorry, this thing was done, but it was done in a process that was not really very useful to devolution at that point in time. We're not saying the equipment is completely nonsensical, no. For example, if you travel towards Aga Khan Hostel on Limuru Road, is it Limuru? Okay, Limuru Road. There's a big sign there, PET scan has just arrived at Aga Khan. Now I remember that if you have PET scan, you must have people who are going to put PET scan. Why did Aga Khan also delay bringing in PET scan up to today? Because they are preparing. Give you another example. When I was Minister for Medical Services, I went to Nairobi Hospital. We went to the president to open the new oncology and cardiac center there. And after we had opened it, things were over. I sat down with the CEO of Nairobi Hospital. What was his name again then? Mailu. And
Cleopas Mailu.
Yeah, Cleopas tell me, this is fantastic. This cardiac, we need an oncology center in this city. I'm glad you've done this. Cleopas told me, Mr. Minister, just a minute. Yes, what you have seen is very good, but I have problems. I say, what problems do you have? I needed to import oncology nurses from South Africa. I needed to import medical physicists from South Africa. I needed to import oncologists themselves from South Africa. I don't have enough here. And I'm paying through my nose for these medical physicists and nurses. I'm paying through my nose. So we really have to train our people in very quick time to cut down on these costs. So I'm saying that, look, please let us approach the health sector very rationally, and let us critique this equipment, not because we are rejecting them, but just saying, if indeed we are paying more for leasing over the next 7 years, what's the logic of leasing this equipment when we could have bought it at the time we need it?
That's the question.
That's the
question. All right. We actually supposed to be winding up right now. And briefly, I would love us to comment, because I think December the 1st, the President will be launching the universal healthcare, the pilot programs. That will also coincide with the World AIDS Day. But in terms of realizing universal healthcare, because as I've mentioned, we are not focusing on the other component of the universal healthcare. Much focus has been on the financing bit of it with the NHIF card. But accessibility still remains to be a problem as it is. And you've also given out some of the tickling problems, like now human resource and, of course, also the equipment and the quality of healthcare. It's not just about having the NHIF, but do I have a quality healthcare? Can I access the premise? Accessibility also has to be another niggling worry as well. So as we're winding up, how will also this, in light of what is coming up now with the facilities that are not being used, they're still actually, still even unpacked, how will it sort of affect the realization of universal healthcare? Briefly, as we're winding up.
First of all, I don't think anybody can put it half as well as Professor Nyang' Nyong'o has done. And I think it brings out the fact that we are not actually disagreeing. We are saying very much the same thing, but differently. I think that's the point that should come out here. Dr. Kakai, who tweeted, talked about capacity building. And he challenged the county governments on the issue of capacity building so that we cannot sit here 5 years later and we are saying there's still no capacity. They should be able to tell us how far have they gone with this capacity. The issue of that we are still preparing, as Professor Nyang' Nyong'o has said, tells you we are not ready. And that is the point of departure. That's the point that I was trying to make when I said it's not that I'm saying the health should not be devolved, but we must realize that the needs are different. Like I said, what afflicts us is different. And the way Senator Pogisho put it is very good, that the needs of West Pokot are not the same as the needs for Kisumu. And that is why he made the point that, and I support that 100%, that it cannot be one fits all, because if you dump the machines in West Pokot for things that they're not ready for, then that's a waste.
Thank you.
And I think that is what I meant when I said that we may not have been ready for devolved health, because we need to build capacity so that West Pokot is at par in terms of capacity, and then it can say, this is the equipment that we need. Does it come from the national government or from the county government?
Thank you.
That's a different question.
Thank you very much. Right, let's hear from Pogisho. Briefly, yes, your headline thoughts, 30 seconds.
Yes, but I think that the proposal to have a select committee to look at this afresh must now begin to expand the need of standardizing healthcare in the counties to include making sure that the specialists are also accompanying this equipment. That means if the government has decided that 2 hospitals must be equipped, they must also say that in each county we are going to find this kind of specialists to deal with those equipment, be able to then to expand. But that's the standard, you see, so that you don't leave it to the counties to try and catch up. And my problem is the counties trying to catch up with the situation which is already there. In fact, it's going to disadvantage a number of them. So that's one. Number two. Thank you. But I think just want to say that probing the corruption of all these things that we are going to go into is very important. Let's find out who are these people who are hiding even that information that we need to have.
Thank you. Okongo Mogeni, 30 seconds.
I think my brief is, let's audit the process that was followed in procuring this equipment. That's very key. And fully to agree with the Prof that universal health care is not just about county referral hospitals. We need to strengthen our community health centers, our dispensaries, ensure that county governments have enough response equipment like ambulances. That's how we attain universal health care. But I really hope that Matiang'i and Macharia will fully implement this.
Finally,
in the Matatu
Professor,
sector.
30 seconds.
We will never be completely ready. We must be progressively ready. That means that the old English saying necessity is the mother of invention is very true. Universal health care is a necessity. Nay, it is vital. It is important for all of us. We have to implement it. So even if we don't have adequate human resources, we don't have adequate equipment, we have to implement it. We shall invent as we go on.
Thank you very much.